Hello, my friends. Today I wanted to share with you one of my secrets to look like this, even if I am a grandmother, like you all know. The first thing is to go to a professional that helps you look better, younger, refreshed, without, any exaggeration, so you don't look bad like a fish. I want to introduce my friend, Dr. Rafael Diaz-Yoserev. He has been doing that to me for 10 years. Shh, it's my secret.
She never looked like a fish.
No, never. Because he's actually a doctor. That's one of the things that you have to have in mind every time you want to go for a little touch up. Remember, just a little bit, but it's enough to look great. Look, no lines. Botox is for me the answer. Okay, doctor, question one. Can you apply the Botox any part in the face or only in the front and the sides?
Well, there's multiple areas. The basic area that everybody knows about is the upper part of the face, and there's three areas in the upper part of the face. The glabella, which is what controls the muscles that bring the eyebrows in the center and towards in and down in the sides. There's only one muscle, which is the second group, only one muscle, that's the frontalis muscle. It's the only one that brings the eyebrows up and is responsible for all of the horizontal lines on your forehead. This is responsible for the lines here, what goes
The number 11 that I call.
normally called the 11, right. And then the third group in the upper face will be the outside part of the vertical fibers of the orbicularis orbis muscle that goes like this. Just the outside part that when you squint creates the lines here. That
And you never apply here because that gives you the skull face.
Right. No, you can apply it here because then you won't be able to move the eyelids as well.
Because I see horrors.
Right, it's only the vertical fibers of the orbicularis orbis.
Okay.
And one common misperception with that is that when people are going to show you their wrinkles in that area, they smile. And it's two different things. One thing is when you squint, that's what the Botox control, only when you squint, because it's only the vertical fibers of the orbicularis orbis. Now when you smile, you're bringing the cheek up, and that brings all of the skin of the upper cheek up into that area. Those wrinkles will never be, they will be lessened because you're not pulling with the orbicularis orbis. It will be lessened, but
they're gonna be there. So the smile is gonna be
natural. Some are going to be there when you smile, especially if you have a big smile.
Okay.
So that's a common misconception. People get Botox and then they say it didn't work for me, and they're smiling. But you ask them to squint and they have nothing.
But you want to smile, to be able to smile.
Obviously, and that's okay. Those have dynamic wrinkles. Right, but there's other areas where you can use Botox. You can use it in small amounts in the upper lip to minimize
But they got the smoker lines?
What they call the smoker lines, and also gives you a slight flipping up of the vermilion border of the lip.
Interesting.
You can use it in this area here. The different people injected the different heights here, but to affect what we call the DAO, or the Depressor Anguli Oris, that brings the commissure of the lip down. You apply it here so that this doesn't go down as much when you do your expressions. And in this area here, in small amounts, 1 centimeter apart, the platysmal muscle, which is a thin muscle in the neck, goes all the way up to the lower part of the face, or this part of the chin here. And if you apply a small amount here, this muscle is pulling this down with the tone of the muscle. It doesn't much, but it's pulling it down. So if you apply some there in a small amount, it allows all of the other muscles of the mid face, the risorius muscle and the zygomaticus and all of those muscles, to pull this up a little bit. It's not a
But you can notice a little natural difference.
Yeah, in some people more than others, you can bring a bigger definition here and a small pull up.
That's great too.
And in the neck, when you have like I have some the bands, vertical bands in the neck, people tend to think that is the skin that is too loose. Of course, the skin is loose, but it's called platysmal bands. Those are bands, vertical bands formed by the
muscle?
The muscle itself, and so we inject directly into the muscle along the band to lessen that, to soften that up. And then intradermally to improve the texture of the skin.
Excellent.
So it's a
I
lot,
didn't know they have
right.
a lot of applications.
Right.
And a lot of guys do it, right?
Well, a lot of guys and girls. And
No,
women, of
girls,
course,
we all
of
do it,
course.
but a lot of
Oh,
guys
yeah.
can get improvement
Absolutely,
with this.
Absolutely.
Excellent.
And also I forgot this area here, the risorius for the bunny lines.
Okay. So here we go.
Right. Also, as Lily was pointing out now, here, okay, this is a mentalis muscle, and when people have a lot of wrinkling here and little pox in there, which is called pure orange, like orange skin, here, injecting the mentalis on both sides lessens that up. It smooths
Relaxing.
this out.
Very good
So
to
those
know
are
that.
the advanced uses of Botox.
And you can also call the number in the bottom to ask for more information.
So now we're doing the first area, which is the labella. So we're treating here the procerus muscle. This is for superciliary depressors on both sides. When we inject, you get a little bump in the skin like that, and that's the amount of fluid that we use to reconstitute the Botox, and that's normal saline, that's reabsorbed within 3 or 4 minutes.
Yes.
So before you leave the office, the little bumps there will be gone.
I know. And I don't feel any pain.
We use the vibrator to trick your brain into feeling less the discomfort of the needle. That's using the gateway theory of pain. And that blocks the nerve pathway of the pain into the brain.
And it actually works.
It does. Okay. I change the needle frequently. Every time I do one area, I change the needle because the needles are very thin. And as you prick into the skin several times, the needle gets blunt. The tip of the needle gets blunt, and then it hurts more, obviously, because you have to apply more pressure, and it hurts more when you apply it. Now, when we do the forehead, go up with your forehead, like, okay. We take a look at how wide your frontalis muscle extends. Because frontalis muscle is a muscle that has a lot of different varieties in individuals. Some people have like 2 bands on each side, nothing in the front. You can see that in that particular individual. Some others, like you and I, have it like from side to side. You have to apply all the way, right? And some other people have in the center and not too much on the side. So you have to know exactly where to apply it here. That is not a constant.
So it's depending on the person, exactly.
These ones in particular, this area here, that's constant. And this area here is essentially constant as well, because you're only injecting the vertical fibers of the orbicularis orbis, which is always like this, right? But the frontalis muscle is a very inconsistent muscle, a lot of variance from person to person.
Okay.
So as you reconstitute the botulinum toxin products, the different products, bo-tox, Gummy, Dysport, etc. In your case, by the way, you know, we're using Gummy, which is my preferred one. So each injector will reconstitute in a different way. It comes like a little powder, right? And then you reconstitute in normal saline.
Okay.
Depending on how much saline you have, then you have the concentration of the Botox that you're injecting, and you know how much you're injecting in units of the product, which is what's important.
I have a question that somebody did to me. He said, what happened if they injected into a vein?
If you inject Botox into a vein, the amount that we use, it's essentially nothing's gonna happen. It's
Nothing's
gonna be
okay.
over diluted with the.
But you know
with the
exactly
blood.
where you put the needle, so.
Right, but you'll see if you put the needle into a vein, you see it immediately, you're gonna get a little bruise.
Okay.
Usually it's not a big bruise with this type of thing, because
A
it's a very
little
small
one.
needle, you notice it immediately, you put pressure on it, but you'll get at least a little
A little bruise.
a
Okay.
little bruise. But if a little bit of Botox goes into the vein, it's
Nothing happens.
usually inconsequential, because it is immediately,
So
the
little.
amount that you've injected is so small that it's super diluted in the bloodstream and doesn't.
Good.
Now, the other thing is that you have to also see if the people, the patient, when you raise it, you raise it all the way up to the hairline, because some people have, like your forehead is not too wide, but if you look at mine, it's very wide. If you don't supplement it close to the hairline, then what can happen is you get what's called recruitment, because you've numbed or minimized the movement here, right? And then your body would recruit this area of the muscle to do all of the movement.
Oh, I see.
That will be done by the whole muscle usually, and then you begin to see these lines here. It's called
So
recruitment.
the lines will gonna go up.
Right. So in here, obviously, when you need to supplement here, it's usually a smaller amount, but it's also necessary, because otherwise you'll get wrinkling up here. Okay. Now we go to the third area in the upper face, which is the crow's feet. The wrinkling here, as I said before, we do the vertical lines, so the vertical fibers of the orbicularis orbis, only this area. We usually do one here, just inside the area of the upper eyelid and below the eyebrow. Another one just outside the bony rim here, and another one just inside the lower lid, right above the bone, far away from the edge.
And I like the way you pull my eyebrow a little bit up. It looks natural, but it's like a refresh in the eye.
Right. The way to do that is when you apply the Botox here, to stay away from here, to make sure that you don't numb the area of these fibers of the frontalis muscle too close to the eyebrow, because that will drop the eyebrow
Okay.
down. So the trick to that is to stay away from there, to make sure you don't drop the eyebrow, because if you drop the eyebrow, you can't fix it until the effect of the Botox goes away. So you recuperate that in about 4 or 5 weeks. But if you leave this free and then you use Botox in the one that brings the eyebrow down, then the tendency is for the eyebrow to go up a little bit more.
To open a little
So
bit.
I am doing it not by stimulating this muscle, but by decreasing the function of the ones that oppose that movement,
Awesome. I see.
which is what bringing it down so that it can freely go up.
Good.